What are normal thyroid levels for pregnant women? Imagine your body is a finely tuned orchestra, and during pregnancy, it needs to adjust its tune to support both you and your growing baby. One key part of this harmony is your thyroid gland, which produces hormones essential for your baby's brain development and overall growth. But as your body changes during pregnancy, so do your thyroid hormone levels. So, what exactly are the normal levels for pregnant women? Let's explore. During pregnancy, your thyroid hormones and thyroid-stimulating hormone levels shift naturally to meet the increased demands of your body and your developing baby. These changes mean that the normal ranges for thyroid function tests are different from those in women who are not pregnant. For example, the levels of thyroid-stimulating hormone, or TSH, tend to be lower during pregnancy, especially in the first trimester. This is because human chorionic gonadotropin, a hormone produced during pregnancy, can stimulate your thyroid and suppress TSH levels. In the first trimester, a healthy TSH level is generally considered to be between about 0.1 and to 0.5 or 3 for milli-international units per liter. In the second trimester, the range usually shifts slightly higher, around 0.3 to 3.0 or 3.6 milli-international units per liter. By the third trimester, TSH levels can be a bit higher still, roughly from 0.3 to 3.0 or 4.0 milli-international units per liter. Many health authorities, including the American Thyroid Association, recommend keeping TSH below 2.5 milli-international units per liter during the first trimester to support a healthy pregnancy. As for free thyroxine, or free T4 levels, they typically stay within the normal range but can fluctuate slightly. Since the fetus depends on maternal thyroid hormones, especially in early pregnancy before its own thyroid starts working, maintaining appropriate free T4 levels is vital. These levels should be checked with tests that are validated for pregnancy because they can vary depending on the laboratory and population. Monitoring these levels is very important because abnormal thyroid function can increase risks during pregnancy. High TSH levels, indicating hypothyroidism, could lead to complications like miscarriage, preeclampsia, or low birth weight if not managed properly. Conversely, very low TSH might suggest hyperthyroidism, which also needs careful attention. If TSH exceeds 10 milli-international units per liter, treatment with thyroid hormone replacement is usually recommended. Even slightly elevated TSH levels above the trimester-specific upper limits, especially if accompanied by thyroid antibodies, may warrant treatment to reduce pregnancy risks. For women planning pregnancy, aiming to have a TSH below 2.5 milli-international units per liter before conception is ideal. During pregnancy, regular testing helps ensure your thyroid levels stay within the safe, recommended ranges. If you have hypothyroidism, your doctor might increase your thyroid hormone dose by about 30 to 50% to meet the increased needs of pregnancy. Remember, every woman is different, and your healthcare provider will tailor your thyroid management based on your individual health, iodine intake, presence of thyroid antibodies, and symptoms. The key is consistent monitoring and working closely with your healthcare team to keep your thyroid levels balanced for you and your baby. In summary, during pregnancy, the normal thyroid levels are lower and specific to each trimester. TSH should generally stay below 2.5 in the first trimester and up to about 3.0 to 4.0 in later stages. Proper testing, interpretation, and management are essential to support a healthy pregnancy. Always consult your healthcare provider for personalized advice and care to ensure the best outcomes for you and your little one.